I'm Brenda Tracy. I'm an RN here at the health department. I would have to say that I like the autonomy as an RN here, because with some other places that you may work as an RN, you are following, every decision is brought forth to maybe a physician or an NP, and then you go forward. Whereas here, our physician is only here every 2 weeks. We can reach him by phone, but what we do is we work under standing orders, which is really nice. It gives us a lot more autonomy. I've been here a long time, and so I've worked in most of the programs in the clinic, but even if you've only worked in 1 or 2, over time, you become the subject matter expert. So what's really nice is that other people in the community, providers, it could be nurses, anybody who's working in that area will give us a call, ask us for guidance, direction, and that's fulfilling as a nurse, to be able to, as just an RN, to be able to give that guidance to others. So as an RN for TB, what we do is almost everybody that works in healthcare or goes to school in healthcare has to get a TB test. So when those TB tests come in as being positive, then a lot of times they refer them to us, because you have next steps. You have to get a chest x-ray, you have to interview the patient, make sure they don't have any signs, symptoms of active TB disease where they could be contagious. And so we walk through those steps with the TB patient. And then at the end, if everything is going well and they're not sick with TB, they're just infected, we almost always encourage treatment. International travel is my favorite because they're not sick when they come here. They're not children coming in needing shots that are afraid. They're coming because they're excited about a trip. And so we sit in this room and we meet with them. We go over one by one each page. We ask them which of the vaccines that they haven't had would they like to get. We work with them on pricing because vaccines are very expensive. So if it's getting really pricey, we talk to them about what is their relative risk for, let's say, chikungunya. And if they can maybe do these prevention methods of the mosquito spray and the spray for your clothing for mosquito barrier, that may help them and save them some money. A big part of public health nursing is education. And a lot of people that we work with, not so much in international travel, but in all the other programs here, they're usually lower income, maybe lower educational level. They may have no insurance. They may have just come to this country from somewhere that they just don't know this information. And so not only is education a big part of it, but really being empathetic to their life. What are they going through now? How can we help them? You can't just spew out information at them to go do this, this, this. You have to work with them. How can we get you to get this prescription? How can you pay for it? What programs are available? You become a little bit like a social worker, especially in tuberculosis. We do a lot of that. We work with a lot of patients that are substance using and the effects of lifelong use, and how to work with them to help them get to a point in their life where they are successful with their health and their health care. That's what I really like, being an advocate for those patients that nobody has advocated for.